Hello, everyone, and thank you for joining us for today's webinar on the strategies for dealing with COVID-19 while working safely on the construction job site. My name is Jeffrey Van Ryan, and I'm the Technology and Codes Coordinator for Local 669. Presenting this material today is Gary Engel and Rob Starcher. Both Gary and Rob are 25-year members of Local 669. Gary is joining us from Northern Indiana and has been an instructor for the JATC for 8 years. Rob is from Ohio and has also been an instructor for the past 3 years. Gentlemen, thank you for taking the time to present this training to us today.
Thank you for having us.
Appreciate it. We put this course together to serve as a way to outline the steps that employees can take to reduce the risk of exposure to COVID-19, both on the job and at home. In this course, we're going to describe how to prevent worker exposure to coronavirus, what protective measures can be taken on the job site, personal protective equipment and work practices that can be used, cleaning and disinfecting procedures, and what to do if you become sick from COVID-19. I do want to make a disclaimer that the material presented in this presentation was the most up-to-date at the time of this writing. This has been a very fluid topic, as you've seen on the news, and some of the info may be outdated by the time you see this. This presentation is in no way directing or offering any medical direction, but merely presenting information to be discussed. As you will see by the end of this presentation, by following a few simple steps and procedures, we can minimize our exposure at work and home and still maintain our productivity.
There are 1.5 million viruses in the wildlife, and when a virus makes a leap from animals to human, it's known as a zoonotic or zoonotic virus. Zoonotic viruses in the past were responsible for the SARS epidemic in 2002, which SARS stands for Severe Acute Respiratory Syndrome, and the MERS epidemic in 2012, which MERS is a Middle East Respiratory Syndrome. Don't confuse those with MRSA, because MRSA is a bacteria. It's a resistant bacteria. Also, I'd like to start off talking about, I mentioned epidemic. Let's just define what an epidemic is. It is when a disease affects a large number of people within a community, a population, or a region. And pandemic, which is what we've got going on now, is an epidemic spread over multiple countries or continents. The SARS-CoV-2 virus causes a disease called COVID-19. Corona virus is also another way of it's described as a coronavirus because of the way it looks under the microscope from the spikes that protrude from the surface of the virus. Also, viruses that cause the common cold are also coronaviruses. There are several antibody tests that you can have tested on yourself to see if you have had the virus in the past. Unfortunately, it won't tell you if it has it right now, because it needs to know the antibodies, see the antibodies that were created if you had it. Also, there is no guarantee at this point. Science doesn't even know if having the antibody in your bloodstream will prevent you from getting the disease again. So that's yet to be discovered. Also, some of the antibody tests that have been going around haven't been as effective as others. The news was a couple weeks ago that the antibody testing was less than 50% accurate, which is pretty surprising. Only a diagnostic test can confirm if you have the actual virus at the time.
How is this virus spread? It's spread when infected people cough, sneeze, or even with them breathing They've mentioned that even speaking could also spread it. It's spread from person to person, most likely through close contact. That's why we're asking you to socially distance, stay 6 feet apart. The main thing that we're looking out for are the respiratory secretions or the droplets, especially when you cough, sneeze, or possibly even talk. They hang in the air, and that's how you get them into your system, your lungs and nose and everything, by breathing them in. You're going to get some illness that will be mild to severe respiratory. Your symptoms could be a fever, a cough, shortness of breath. A severe case is going to present like a pneumonia. A significant percentage of healthy adults will only show symptoms of a severe cold. The thing we got to watch out for, you'll hear us mention time and again, is asymptomatic. You could have this COVID-19 and not even know it. You could be spreading it actively and not even know it. So that's something we really got to watch out for.
Yes, that's a frightening thing, being asymptomatic. Now, the virus is also spread when a person touches an infected surface. So anything that you've touched, and then you can touch your face or your mucous membranes and absorb this virus into your body. The virus will live in aerosol form for 3 hours. It can live on copper for 4 hours, 24 hours on cardboard, or up to 72 hours on plastic or stainless steel. Things that we touch every day at the job: tabletops, tools, valve handles, railings, especially your telephone. You can begin to see why social distancing and sanitizing surfaces are important.
As we mentioned a couple slides ago, some of the symptoms of a COVID-19 infection are fever, a dry cough, fatigue. Some infected people will show no symptoms at all, asymptomatic. Some of the other possible symptoms could be shortness of breath, sore throat, loss of appetite, diarrhea, loss of taste, or loss of your sense of smell, nausea, and vomiting. As we said, some people will be asymptomatic, meaning they're showing no signs at all. On a side note, an article came out March of this year talking about fevers and the average body temperature. It was put out by the Harvard Medical School, and we were considering a fever anything 100.4 or higher. Our normal temperature since 1851 was 98.6. A German physician, Karl Wunderlich, did a study, and that was the median temperature of everybody. But they've actually found that it has been lowered 1.06 degrees since then. So now our new normal range is 97 to 99, and that new median normal is actually 97.5. So once again, the numbers we're really looking out for is normal is anywhere from 97 to 99, but if you're 100.4 or higher, that's when it's time to take action.
Really, the best way to defeat a virus is through immunity. And we will be looking at the next few slides to find out things that we can do until a vaccine arrives or is invented so that we can get that immunity.
That's right, Gary. One of the main things we can do is we can wash our hands. We want to make sure we're washing our hands with a good soap and water for at least 20 seconds, or a hand sanitizer containing at least 60% alcohol. Our skin is our largest organism of the body, and it covers approximately 20 square feet. The skin and hand washing is our best defense because it actually helps wash those germs away. Due to the nature of our work, though, we don't always have access to running water. Sometimes we do. We're probably going to see a little more and more of places giving us actually areas to wash up as these things progress. But what are some of the ways that we can get our hands washed on the job site? My company actually bought containers, jugs, about 3 gallons each, and they supplied us with jugs of soap. So even though it's not warm, water, it's at least allowing us to get the soap on our hands and wash those germs away. It helps break down the protective coating of the germs so we can get it washed away whenever we're doing our hand washing.
When it comes to our PPE on the job, it really isn't changing that much. Perhaps the type of gloves we're going to be wearing. If you can get some nitrile gloves or latex gloves, be able to wear those. That'll keep you from touching surfaces and then getting it on your face or ingesting it somehow. Actually, wearing nitrile gloves kind of reminds me not to touch my face, and it's been pointed out to me before that doing these webinars that I've touched my face quite several times, so I've been consciously trying not to do that. Big thing coming up, or that has been coming up here, is talking about wearing a mask. People wear a mask, you don't wear a mask, within 6 feet, you wear a mask. CDC has studies that show that the general public use of a face covering is helpful. Actually keeps you from spreading whatever germs you have to anybody that might be close to you, and vice versa. So it's something that you should get right in your mind to be able to start wearing a mask. I know that I have started wearing them almost all the time now, going out, even after work, going to the store or whatever. Everybody's state is different as far as what's open or whatnot. But when it comes time to interacting with each other, wear your mask. The only thing I have to say about that is we are used to using N95 respirators if we're cutting concrete or drilling or something like that. But let's not be using those respirators for this face covering. Let's save the N95 mask for the professionals. Incidentally, N95 stands for, it means that the mask will filter out 95% of particles that are 3 microns or larger. That's 3,000ths of a millimeter. So just by comparison, human hair is 50 microns. So you should have no trouble getting the correct PPE for your job, and keeping the cleaning and the disinfectants that you're going to need, and keep that at work.
Those are good points, Gary. You mentioned the N95, it being actually a respirator. Technically, to wear one of those, you need to be fit tested. So that's a good point to bring up. I know you've probably had people tell you the same thing. Oh, I can't wear a mask, trouble breathing. For some people, that may be true, but for the most of the society, the able-bodied adults, they don't really have to worry about hypoxia, which is actually a lowering of the oxygen in the blood. One thing they do have to look out for, though, it's called hypercapnia. It's the excessive carbon dioxide buildup in the blood. Very slight buildup's not going to be that big of a deal to you. Once it builds up a little further, you'll get your headaches and things like that. I want you to think about this. Surgeons and nurses, when they're going in for a long surgery, they may be in there 6, 7, 8 hours, and they're wearing a mask the whole time. The last person I really want to get lightheaded and dizzy would be a surgeon that's operating on me. The levels of hypercapnia, at 1%, you're going to start to feel a little drowsy. At 3%, you're going to get a little mild narcosis. You're going to get an increased heart rate and blood pressure. At 5%, you're going to get some dizziness, some confusion, a headache, and some shortness of breath. At 8% buildup, you're going to get diminished eyesight. You're going to start sweating. You're going to get some tremors. You may even lose consciousness. So those are things to be careful of. You probably don't have a lot to worry about with it, but it's just something to be mindful of. also with the masks, Gary, we want to make sure we're not putting them on anyone who can't take it off for themselves. For instance, like anybody under the age of 2. So your comment about touching your face, I have a hard time with it myself. The disease can be spread by touching an infected surface, then touching your face, eyes, nose, and mouth. There was a study in 2015 by the American Journal of Infection Control that said people actually touch their face more than 20 times an hour on average. About 44% of that time, it involves the eyes, nose, and mouth. So if you think about that, you're actually touching your face once every 3 minutes.
Well, here is my favorite part of this broadcast is to teach you how to sneeze and cough into your elbow. This is the idea. We all have learned this back when we were kids, but surprising number of us also forgot it. Sneeze into your elbow, avoid coughing in and sneezing into your hand where you're going to touch other surfaces. Just totally makes sense, right? If you want to, sneeze into a tissue and discard it and then wash your hands or sanitize, that's fine. Sneeze into your elbow, that way you can't touch anything.
We've all heard it, social distancing. That's something we do at the job. You plan your work, try to stay 6 feet away from each other. I like to refer to it as physical distancing. We're all social people. We want to talk, hang out with our buddies, sit around the campfire, have a few beverages. As long as we're staying away from each other, 6 foot distance away, we're actually protecting ourselves. So think of social distancing more as physical distancing. Say you're in a pump room. It's okay to be in that pump room, have an apprentice or a fitter with you and be working. Just don't be working right on top of each other. Try to stay back a little bit. Stay out of large gatherings, crowded spaces. Just last week, the CDC came out saying in a briefing that contact contamination may not be as big of a deal as we originally thought, but we also have to keep in mind, if you touch something and then bring it right to your face, you're going to bring the germs up. So as far as picking it up off of the surface, you can still do that and bring it into your body that way.
Yeah, and use some barrier tape and restrict your area where you're working to keep other people from coming through. Hang a informational tag on there so that they know, why that you've asked them to go around. Use anything that you can do to keep other people away from you. We need to distance ourselves from each other so we're not absorbing their germs. Ultimately, we want to have a flat curve. You've heard talk about this on the news or on the television every day, what the curves are doing. So when they talk about the curve, they're referring to an increase and then hopefully a subsequent decrease of the number of cases known during a specific time during an epidemic. So they're keeping track of how many people are getting this disease. The trouble with a steep curve, the real danger of the steep curve is when too many people get this disease at the same time, then the hospitals in a given area are overrun and they can't take care of the people properly. We're seeing a resurgence of curves in some states, some areas in states. They've even broken it down into counties. I know that Houston, whatever county in Texas that Houston's in, they're having a time with this, and also up in the Pacific Northwest is also having a resurgence. This is what we're trying to do. So just keep yourself distanced.
As you mentioned social distancing, Gary, one of the main things that we're having trouble with, especially in Florida, some of the southern states, is we're overloading the ICU. On average, the ICU is about at a 66% occupancy rate across the country. So that's a normal day. But as we're starting to get a lot more of these cases, we're having to put people into the ICU, and they're getting upwards of 80, 90, 95%. And at that point, we start to run out of space and resources to treat people. So as it's making its way through the population, we may be protecting the older people, but the younger people are now getting out, and social distancing is kind of going by the wayside in some spots. It's really making it a taxing issue for the ICUs. One of the other things as we talk about social distancing is we may need to consider our lunch breaks and our morning break. We don't want to get large groups together. We want to keep them down to 6 to 10 people maximum. We may have to start staggering our breaks. We may have to go to a different area of the building away from some of the other trades, things like that. So it's just something to keep in mind as we start to move about and go on these job sites, just things that we have to maintain.
Another way to social distance is conducting our job site safety meetings, perhaps on by the phone or even computer. We're going to have to start using our heads to decrease the amount of time we're spending in direct contact with each other. All this goes right back to keeping people out of hospital, and I wanted to mention from the CDC website that although the deaths attributed to pneumonia, influenza, and COVID have decreased last week from 11.4% of those cases that are admitted to the hospital down to 7.1%. The numbers are still remain above the epidemic threshold. So, and we know that social distancing and these other things can work because they also keep track of other diseases. They keep track of flu every year. And we know that the lockdown is working, social distancing is working, because the number of flu cases have dropped to a record low at this time of the year for all age groups. So it's kind of proof that says it's working.
Good points, Gary. Very good points. Job site trailers. We all have seen them. Trailer cities, a bunch of trailers all together. May not be the places you want to hang out nowadays. We need to minimize our trips to the trailers. We need to only go there when necessary. If we've got to get together, we need to limit the size of our groups, 6 to 10 people, staying at least 6 foot apart. As long as the weather's nice. If you need to have a meeting, have it outside. Stay apart from each other. We don't need to be sitting around a table getting ready to share donuts and everything. Get the meeting done, stay separated, and get back to work.
Yeah, consider using video conferencing or video calls to take care of any meetings that might not be necessary to be face to face.
Yeah, with some of these meetings, you mentioned maybe having to find different ways to do them. We may need to actually report job conditions to the office. We may not want to get as many visitors out. So some of the ways that we can report those conditions would be pictures, videos, maybe even drones. If you can talk your boss into it, go for it. Anything that we can do to avoid that face-to-face contact. Video conferencing has worked great. If you're somebody that's having a little trouble with the technology, maybe reach out to a younger fitter, maybe an apprentice, somebody who's up to speed on some of these new technologies. If you don't have anybody to reach out for, reach out to your instructor in the area. They may be able to at least get you started. I'm not saying that we're experts or anything, but we've been dealing with it a little bit. We may be able to help get you pointed in the right direction. As we bring people on our job sites, we're going to have to be screening them. We're going to have to be taking temperatures. We'll be having to ask them the questions that we've all been asked. Have you been confirmed positive or been around anybody confirmed positive for COVID-19? Are you currently experiencing or recently experienced any acute respiratory illness symptoms, such as fever, cough, shortness of breath? Have you been out of the country in the last so many days? Have you been in close contact with anybody, like I said? And just overall general questions of health and safety.
Job site deliveries are a way that we encounter people that we don't normally encounter during our daily work. Rob mentioned screening at the place where I work at. They screen your temperature every morning before you come in, and really that's just the least that they could do, because yes, they're going to keep somebody who's actually sick. They're going to turn them and send them home, and that's great. But remember, this disease can be asymptomatic, especially in young and healthy people. So you may be carrying this around and not even know it. So, or conversely, the people that are delivering to you. I started counting up all the people that I might encounter in 1 week. I was getting delivery from my office as far as parts goes. I had engineering staff showing up, fab shop delivery, the Porta-John people, the folks that deliver water, tool delivery, lift rental, and then parts from other stores or whatever you might be buying. And then, of course, meetings with other trades. So be aware that these folks are not on your everyday list of people that you're around. So you need to distance yourself from them as politely as possible.
Very good points on all the people coming to the job sites, Gary. Read an article off of constructiondive.com that's saying that we may have to get used to this. This could become our new normal for construction. The experts are actually predicting a couple different things. They're predicting that our job sites are going to become a little cleaner, a little safer. We may have to staggered shifts, do temperature checks, things like that. We may have to stop our work and clean up a little more often. We may have to bring crews in to clean to help minimize. And this may be something that continues on from here on out for a long time to come. Distancing is going to be our new normal. That use of technology we just talked about for meetings, problem solvings. Actually, inspections could even be started to be done remotely. There was a fire inspector in Nashville that asked for 360-degree photos and a video to be sent in, and he actually approved the inspection that way. I know of a fact, a hospital here in Northern Ohio, the state fire marshal had the maintenance guy walk around with his video camera and videoed, and he actually passed their inspection that way. So we're already starting to see some of this. With all that being said, our project's going to probably take a little bit longer. We're going to have to incorporate that time. We're not going to be able to run and gun like we used to. We may have to slow down to go fast. We may start to see less and less people on the job sites in regards to like office personnel. They may actually start to telecommute a little bit more. So those trailer cities that I was just mentioning, we may actually see those start to shrink down. We could start to see the union influence grow, because as we start talking safety and health of workers, that could be one aspect that we see a resurgence in. We're going to see our project types change. We're going to get away from the hospitality, the retail, the entertainment. We're going to start to get more into the healthcare, the construction of healthcare facilities and healthcare warehouses. we may actually see a resurgence in manufacturing here in the States. Companies are going to have a tough time getting their materials back into the States for sales. So we may start to see a lot of that come back. On that same note, though, supply chains are going to be affected. We've already seen it. You used to be able to call and say, hey, I need 300 feet of 1-inch pipe for arm overs, and they had it at the supply house. Now things are getting a little bit harder to get your hands on. So as fitters, as apprentices, we need to make sure we're looking a little further ahead than we're used to, so we don't run ourselves out of work. One of the last things this article mentioned was we may see modular adaptations increase. And what that would mean would be things could be built off-site in a more of a controlled environment. For instance, there was a hospital built in Toledo, Ohio, where all the mechanical contractors except the sprinkler fitters were in racks. And these racks were built in a warehouse, drove across town to the job site, put into place, jacked to the ceiling, secured, connected, rack to rack to rack. So we actually may see a lot more of that. We've been kind of doing it for years with our prefab, but other trades are starting to see the advantage of it. As we're entering these buildings, we need to make sure that we're sanitizing our work area. We're keeping our personal distance of 6 feet. You're going to start to see a lot of drinking fountains shut off. You're going to want to make sure you take your own food and water. You're definitely not going to want to be sharing water jugs with your coworkers. We're going to want to make sure that we're washing and sanitizing and cleaning our work areas, maybe during the day. Definitely before we leave. I've always had a saying, leave it cleaner than you found it. So we may need to allow for some extra time, like we just spoke about, in order to get everything clean.
Yeah, job site trailers and your break rooms, any common areas, they're going to have to be cleaned at least once a day. High risk areas, cleaned and disinfected, such as the doors, the handles, railings, tabletops, chairs, anything that you would be touching on a daily basis. We've got to get the trash taken out, and whoever takes it out needs to be protected by wearing some kind of protective gloves. Of course, any portable job site toilet should be cleaned by the leasing company, and that cleaning should be up to at least twice a week, and then they should be disinfecting the inside of that and making sure that there's hand sanitizer in the dispensers. Those things cost money for the contractors, I understand, but having employees go down, that also costs some money. Whoever's doing the cleaning should be wearing the proper PPE, nitrile gloves and gowns as recommended by the CDC. Rob mentioned it 2 times. I'm going to say it one more time. This is going to take time to get these things done. It's not hanging pipe, but it's what we need to do to make sure that we can be there to hang pipe tomorrow.
As you mentioned, Gary, whoever's taking out the trash and doing the cleaning, they need protection. One of the things I witnessed last week, I was at a hospital. They were changing their air filters. They are changing them a whole different way than they used to nowadays. This guy's going in Tyvek suit, gloves, an air supplied hood, just to change filters, because they're realizing they don't know what's caught in those filters. So it's actually becoming more of a hazardous job for them to do. The job site cleaning and disinfecting, we got to make sure we're getting the vehicles cleaned, lifts. We need to clean our lifts and our equipment and our tools at least once per day or before any change in operator or rider. When we're doing that, we're going to be using an alcohol solution of at least 60%. We can use common household bleach, but we need to mix that bleach 5 tablespoons or 1/3 of a cup per gallon of water. If we need to mix a little bit less, we can do 4 teaspoons of bleach per quart of water. But I want to caution you, bleach will start to lose its potency after 24 hours. So you don't want to mix up too big of a batch, then have to throw a lot of it away. As we're talking about mixing up bleach, I want to just say that never mix household bleach with ammonia or any other cleaners. It's just a recipe for disaster. It produces a gas that can actually kill you. So be very careful what you're mixing it with, and mix it to the manufacturer's recommendations.
My wife was very excited to inform me a couple days ago that there are 2 different kinds of bleach on the shelves at the store, and one is for whitening, and that's for your laundry, and then regular old bleach is what you want to use for disinfecting. The COVID-19 virus is a protein molecule covered in fat. Remove the fat and the virus dies. So it takes 80-degree or hotter water to melt that fat. Also soap, or the chemicals in the soap, will help cut through the fat. CDC recommends cleaning surfaces first and then disinfecting. Make sure you use detergent and hot water if you can.
You mentioned cleaning and disinfecting. Some people may be wondering exactly what that difference is. Cleaning is the removal of dirt and impurities, including germs. Disinfecting is actually killing the germs with chemicals. As we're wiping things down, we want to watch for what we call contact time. That's the length of time a surface is held in direct contact or wet with a treating agent. So as long as that chemical is on there, it has to stay wet. For instance, for COVID-19, bleach has to be on there 1 to 2 minutes in order to kill it. Lysol is about 3 minutes, and hydrogen peroxide is actually about a minute. So we want to make sure that we're applying the disinfectant to all surface. We want to use our diluted bleach solution and hold it on that surface for at least a minute to 2. I misspoke a minute ago. We need to have a 70% alcohol percentage on our cleaners. 60% is for our hand sanitizers. So don't get confused. 60% washing our hands, minimum of 70% for disinfecting. With that being said, we've got a video coming up, and I just want to take a minute and thank DeWalt Milwaukee. They were very helpful getting us the information on the proper care and cleaning of their products. So as the video goes, we'll kind of do a quick walkthrough and continue on.
We've mentioned this bleach solution a few times. CDC website has the recipe for this. What Rob is using right there is 1/3 cup of bleach per gallon of water. The thing to remember about that is 24 hours, it's no good anymore. So you gotta remake it again the next day. So always unplug any devices. This comes directly from DeWalt, and they were very helpful with this. Unplug any devices, remove batteries prior to cleaning. You have to wring out the cloths, sponges, whatever you're using for wiping it out, so you don't get liquid down into the product, into the tool. Electrical terminals of the products and the prongs and connectors to power cords and other cables should be avoided getting them wet. When wiping batteries, be sure to avoid the battery terminal areas. Make sure to allow the product time to dry. It's not maybe as simple as you thought as far as cleaning and disinfecting a tool when you have to get it wet enough to stay wet for 2 or 3 minutes, but not so wet to get water down inside the motor. So be careful what you're doing. Household cleaners and disinfectants are typically safe to use, but be careful of anything that might tear up the surface of a plastic or rubberized tool.
Job site exposures. I found it interesting that OSHA actually has said that unless there is visible contaminants or bloodborne pathogens, if somebody comes down with it on the job site, there really is no other special cleaning that needs done. Just everything needs wiped down like we have been talking about. If you would actually start showing symptoms of COVID-19 and you feel sick, go home. Get a hold of your foreman, get a hold of your job site superintendent, call the office, let them know what's going on, because what this is going to do, it's actually going to start a chain of events of they're going to make sure that you're getting checked out. They're going to make sure that you're getting the medical assistance that you need. But you are not going to be able to come back to work until you are free of symptoms for a minimum of 72 hours without the use of any fever reducing or symptom altering or masking medicines. Workers are going to probably need to obtain a doctor's note clearing them to return to work. That's why it's important to have that office involved so they're aware of what's going on. It may take you a couple days to get back onto the job site. With that being said, you don't want them to think you're a no-call, no-show. So keep them in the loop. They're going to be understanding, hopefully, that we'll get you through this, we'll get you back working. If you do test positive, you're going to be required to self-quarantine away from work. You should try to stay home. It's going to be for a minimum of 14 days since your first positive tests. And what we're hearing is you actually got to get a couple negative tests and then you're good to go. If you're put into the hospital, you're looking at a little bit longer timeout that you need to actually be cleared to be able to return to work. Like, these are all just things to keep in mind. Hopefully it doesn't happen to anybody, but chances are, as it works its way through the country, some of us are going to come down with it, that we need to be mindful of what to do.
Yeah. Once again, if you have close contact with a COVID-19 positive coworker, you are required to notify your supervisor. And then you should be prepared to self-quarantine for 14 days. And you're going to be part of a team of people will be trying to find out who you've been in touch with. This is contact tracing. So who you encountered, and then they'll go and continue down the line and try to find everybody so that they can, everybody that you've encountered so that they can be fairly warned.
You know, we've mentioned it a few times about close contact, Gary. Close contact has actually been defined as being face-to-face with somebody within 6 feet for a period of time greater than 15 minutes seems to be about the average. I've heard of some places saying 10, some saying 20, but all in all, I'm hearing 15 minutes, less than 6 feet is what they're considering close contact. As we finish our day, we got to head home. We got to remember what we're taking home to the family. We may want to be taking the boots off in the garage or at least at the door. You may have a alcohol-based solution to spray them off. You may want to actually disrobe out in the garage. I recommend with the garage door closed. Don't do it on your front porch. Your neighbors will be calling the cops on you. But what we're trying to do is trying to avoid anything that could be on our clothes, getting it mixed in with our kids' clothes, the wife's clothes, things like that. Being a sprinkler fitter, I've always been one who, I get dirty just getting out of my truck in the morning. So I've always washed my clothes separately anyways, but it's just something to think about that we may want to keep things separated. As we start to finish up, Gary, I do want to just say that, as we stated earlier, there are just a few minor adaptations to our normal work routine in order to maintain a healthy environment on the job site and at home. In doing so, we're going to be able to go to work, give our contractors a good 8 for 8, head home, and enjoy some downtime with our families, get together, socially distance, or as we talked, physically distance, and have enjoyable off hours.
Yeah, in closing, I'd like to remind everybody that they have a huge responsibility, not only to themselves and their family, but their coworkers. They have to take the time to complete the extra steps necessary so that we can all return to work safely. And if you have any questions, check out the website at the CDC. If we all work hard toward this common goal, we can all get the job done here.
All right, Gary and Rob, thank you so much for that presentation. And I want to thank everyone for joining us today for today's webinar on the strategies for dealing with COVID-19 while working safely on the construction job site. If you have any questions about today's topic or how to attend any other instructional sessions, please visit the 669 website at sprinklerfitters669.org and find the JATC Contact Us link under the Training tab. Or you can always send us an email at contactus@jatc.org. Thank you and work safe.